A condom killed a very fat woman. Condom can remain inside. So they are not allowed to use the condom. If the man has married you, then the man should never use a condom. Family planning when you're not a married woman, that is a myth. You used to go away to the kraals. And they come after 2 to 3 years. When the child is already bringing water, then again another child is called. There is a specific skin when a woman has delivered. This woman is to wear, showing that this woman is not yet supposed to put herself in any sexual relationship. Pick a panga to cut away the harm of the woman, that what is this thing I'm feeling in your harm.
These implants removed in a very crude way. The man just cuts and removes it. Even they say, after all, even if I produce every year, government will feed, the partners will feed. This uterus in us is like a small bag for squeezing alcohol.
Karamoja sub-region has the highest number of teenage pregnancy and child marriages, and at the same time, it is also among the region with the low contraceptive use. This is partly attributed to culture and religion in Karamoja.
Method like condom use, they say condom killed a very fat woman. Condom can remain inside. So they are not allowed to use the condom. If the man has married you, then the man should never use a condom on you. And more, the distance from where the services take place is far. Like Kabong, which has 27 health units, most of these, the 18 health center tools, where almost some of these methods are not there. And was part of it, the postpartum family planning. It is still a myth. Most people think of lactational amenorrhea, that is the best method. And as one of the ADHOs mentioned, that the context in Karamoja as a whole, when a girl grows, this girl was supposed to grow up to her 30s or late 20s, is when she should now indulge in marriages or to use the family planning. You cannot use a family planning when you're not a married woman. That is a myth that most people were having. And still, on the issue of family planning, the religion part, which like the Catholic, they don't advocate for family planning. Even in the lower health unit, like in Kabong mission, we cannot take any method there. But the
when mothers get something small, like bleeding, they go and talk to the colleagues. And once the colleagues tell them, for me, I'm using breastfeeding as a family planning method, automatically the other one sees that she's wasting time.
But what was the Karamojong way of family planning?
There is a specific skin when a woman has delivered. This woman is to wear, showing that this woman is not yet supposed to put herself in any sexual relation.
When the men were able to keep away from their families for a while, and the elders would keep watch over the young couples to make sure that they are not within when their wives are pregnant. They would go to the kraals, they would go grazing in other areas, and then they will only come back when they have been given a message that their women have given birth. And when they are coming to welcome the newborn in the family, they usually come with a cow that has a calf, and then they will come with a ram. The ram is to make sure that the old women in the family that have supported this woman to give birth are going to eat it. And then this cow with the calf is the one going to take care of this woman, her nutrition during her puerperium time when she's breastfeeding.
They come after 2 to 3 years. When the child is already bringing water, then again another child is conceived, then the man disappears.
Health workers explain their efforts to educate women on family planning.
Abu train us through a partner, which is QAM, on adolescent health. In the training of the adolescent health, we are reaching to the health units where the youth corners are there, where the focal persons are there, and they schedule the days when are the youth to come for these health-related services where different topics are discussed, which is for both school-going age and those out of school. That is the message which I have been trying to do.
A group of women and talk to them. I give them simple examples. I tell them, you know what? This uterus in us is like a small bag for squeezing alcohol. But when you keep squeezing alcohol every time, it will get torn. So it is the same to what we are carrying our babies in. Because when you push your baby, definitely you're losing blood. It is becoming weaker. It is becoming stretched. And a few of them are appreciating that. And another point I told them, you know, everything wears out. Even your own body can wear out. Because you imagine the period you go through when you're pregnant, and then you have delivered, and the body has not yet fully recovered, and then you're moving on to getting another pregnancy. What will happen? Definitely your body will continue to grow weaker and weaker. And because they've seen sometimes some mothers, we've lost them because they end up...
The Assistant District Health Officer, NAPAC, Regina Naras, and Assistant DHO, Kabong, Patience Aroch Ojok, explain that family planning use has increased gender-based violence in their area.
Ended up having these implants removed in a very crude way. The man just cuts and removes it without having an idea that this woman could easily bleed to death because of that. And sometimes, of course, the health workers are also taking on these risks because someone can come and say, who told you? Who gave you the authority? Who gave you the permission?
Men even pick a panga to cut away the harm of the woman, that what is this thing I'm feeling in your harm? Like the family planning method, that you have failed to conceive, it seems something wrong has gone.
They add that mindset change is needed among locals.
Even they say, after all, even if I produce every year, government will feed, the partners will feed. Through the what? Through those programs. So we need to do a lot of mindset.
To the woman, even you are talking to this man, the benefit of family planning, when to start, and the number of children.
Dr. Frederick Makumbi from Makerere School of Public Health and others explain benefits of using family planning.
Very well the usefulness and importance of reproductive health and family planning as one of the wheels of development. And education has come out very clearly that they feel they need to make sure we put their children in schools, because evidence has shown that those who are in school have better indicators, fertility indicators, than those who are not in school. Also, one of the speakers came up and brought up the issue of the economic development and clearly drummed up the fact that we have to be careful to have the number of children we want.
When we look from this context, when COVID-19 came, many teenagers are now the victims. Many of them drop out of schools, conceived. And you find that when you look at the statistic, most of them have dropped out of schools because of lack of family planning, or the message in regards to family planning. I think they had inadequate knowledge on who is to take the family planning. So family planning is still needed.
Kabong District LC5 Chairperson and Karenga LC5 Chairperson Felix Mark Lochel comment on family planning.
To be supported in delivery of family planning services. modern and traditional all integrated together to help the region cope up with the high rates of the population and the high dependency rates that are actually ruining the lives of households in Karamoja.
The population which has gone to school and so many other things.
They promised to support family planning advocacy in their areas.
These implants remove in a very crude way. A man just cuts and removes it without having an idea that this woman could easily bleed to death.